I wanted to talk to you today about the very reason for this event, and this is about the importance of consumer and community involvement in research. So what does consumer and community involvement in research look like? And we use that word involvement and engagement loosely and interchangeably. So really, consumer and community involvement in research is, we're talking about consumer and community reviewers, and I think that's what Terry mentioned before about how to get involved with her research, or to have somebody living with MS or from the consumer from the community actually doing some review of her plain language and summaries of her project. Another example of consumer involvement is research buddies, being part of an advisory group, a reference committee, a steering group, do some research priority mapping, and I know that MS Australia have done an extensive survey on research priority mapping from a large consumer sample. And also consumers being involved with research institutes at a strategic level, not just at a token level, but actually being in the room with decision makers and putting forward their views. So consumer and community involvement is about research being carried out with or by consumers and community members. It's not about it being done to them, about them or for them. Involvement is where consumer and community members work in partnership with research institutions and organisations, and I'm really proud to see how that's forging ahead at the Menzies Institute. So if we look at some things that consumer and community involvement is not, it's not about participation in clinical trials or studies or the gathering of data from people by completing surveys. It's not consultation or interaction between researchers and the community. They're normally one-way conversations, and they're things like research forums, as today, we're sharing information with you, presentations and information sessions. That's not consumer involvement. And consumer involvement is not fundraising either, but what I want to point out, importantly, all those things are vitally important. And sometimes you can't have involvement without participation and engagement, and each have a role to play in the research agenda. So why is consumer and community involvement important? And why do we have consumers and community involved? They have a lived experience of what it's like to have MS or other health conditions. They provide researchers with an alternative view and a different way of looking at things. They help ensure that the research is relevant to the needs of consumers. They have a vested interest in turning the research findings into improved practices and outcomes, and I think that's evident from a lot of the questions that are being asked today from some of the presentations. People want to know what the next steps are from that research and how is that going to be turned into meaningful impact for people living with MS. And I think this is really important for the researchers in the room, is that funders require genuine consumer and community involvement to be evident in funding submissions, and I think that's becoming more and more important. That wasn't Chris, was it?
No.
I just think this is a really important quote, and this is taken from some people that we've been working with at the Western Australian Health Translation Network, of why consumer and community involvement is so important. And that's, as key stakeholders, consumers have an inherent right to be involved in health and medical research. and should be encouraged, supported and given opportunities to do so. I just want to talk a little bit about the MS Research Flagship Consumer and Community Involvement journey, and it probably is at the stage we're moving from engagement into involvement. So we have a Consumer and Community Reference Committee at Menzies that was established in 2019. The committee has its own terms of reference that set out the scope and the objectives for the committee and also the membership, and importantly it reports through to the Flagship Steering Committee, and it's required to demonstrate what they've been doing in the area of consumer and community involvement. The membership of the committee has been expanded. We started off with 12 members, and last year was expanded to 18 members, and that was really due to lobbying from that committee and participation in strategic planning sessions where the committee is being increasingly involved with the research work at Menzies, and was being asked to have increasing involvement. So we needed to increase the membership of that committee. So what are some of the things that the committee has been involved in? The things like reviewing information sheets, consent forms and advertising materials for projects. They review plain language summaries for grant submissions. Reviewing research presentations for plain language content and accessible formatting. Participating in online workshops and focus groups for the development of MS short courses. Being guest panellists in Facebook Live conversations about MS. So we've had input into strategic planning sessions, assisting with organising forums such as today's event has had a lot of input from our Consumer and Community Reference Committee. They've been involved with media training, and they've participated in providing feedback at students and early career researchers forums, and actually providing, say, a plain language lens over some of the presentations. But importantly, you don't need to hear from me about what we've been doing. I think it's really important that you actually hear from somebody who is actually on that committee. So I'd ask Chris to come and talk about some of her reflections being involved in the committee.
Thank you, Viv. So I have been a member of the Menzies Research Flagship Consumer and Community Reference Committee since its inception in September 2019. Last year I was appointed Deputy Chair of this committee. Since 2019, when the committee was first commenced, Menzies has demonstrated its commitment to including consumers in their research in many ways. They have sponsored 2 workshops, helping us develop skills in plain language communication, grant reviews, and sharing research information. At the workshops, we discussed our achievements, challenges, and future opportunities. We have also participated in MS Student Mid-Career Researcher Symposiums, awarding a Consumer's Choice Award. As part of the committee, I have met several researchers, heard about their projects, leading to a greater understanding of how funds raised or donated for MS are utilised and potentially have an impact on those of us living with MS and those yet to be diagnosed. The researchers ensure the research is relevant to the needs of the consumer, use the consumer as an alternative view, and understand the importance of the consumer's knowledge and experience of living with the disease. Since 2019, the committee has had the privilege of hearing about a number of research projects being undertaken by researchers and reviewing documents to ensure plain language communication. These documents include patient information sheets, surveys and questionnaires, wording in event advertisements such as today, the flagship logo and short course modules. Something I have learned from being on the committee is the difficulty that researchers have in translating their research projects into consumer information, and how the committee has had a valuable role in assisting them meeting this goal. I facilitate an MS peer support group in Hobart, and we recently had a researcher, as we heard about, Ingrid, thank you, demonstrate 2 digital tools to us that she was seeking feedback on. There were several questions, and at the end of the demonstration, the researcher asked if there were any members would be interested in using the tools and providing some feedback. 3/4 of the group agreed to do so. The researcher was pleased to gain consumer feedback, as were the group pleased to be involved in, have input into the projects that were being undertaken. A win-win situation, consumer involvement. I feel very privileged and valued as part of this committee, and would strongly encourage others to become involved, as the outcomes of research projects impact on the management and treatment of MS, and hopefully the researchers working in partnership with us will advance progress into identification of a cure. Thank you.